Thank you, Chairperson, for the nice introduction. And this is a very important aspect of discussion regarding diabetes. Whenever Sunil Gavaskar went out of the form, he used to go down to the basics, with his stance, his place at the crease and all, and everything, his lift, everything. The practical aspects of insulin therapy, which we are going to talk about, is on that only, the basics. We get prescription error, dosing error, technique error, storage error, and advice uh, during travel. Now, a lot of insulin are available nowadays in market, and with these type of international conferences, we are able to gather information, and we are very sure about which insulin to use in what situations. And we have got these delivery devices for insulin. All of us know insulin pens pre-filled with insulin, easy to use vials and syringes and insulin pumps. Devices that deliver continuous insulin infusion. So, to start with, prescriptions as a source of error. Illegible prescriptions can cause a lot of problems. All of us will agree to that. And we strongly feel that clinicians should avoid the potentially dangerous use of abbreviation U. In one of the prescriptions may not be legible to you from that distance. Uh, BD is written, and below that it is 4U, and it appears as if this is 44 units. And in the other prescription, uh, uh, you read 10U as 100. So legible prescription is a must. PD as a abbreviation for before dinner should never be used, because if it is before dinner, then BD is frequently used for twice a day. So it can be used as twice a day dangerously. So dosing errors are important. These are the small things which are very important to notice. Expiry date, write down the date and time of opening the bottle, and discard vials 4 weeks from the date of opening. And sometimes manufacturers and pharmacists' recommendations are very important to guide us. Do not use insulin if it is discolored, had lumps or flakes, is frozen or heated. Dosing errors for a complete mixed dose, the right sequence of mixing should be strictly followed to avoid undesired changes in the chemical and pharmacodynamic properties. Resuspension of pre-mixed insulin and all other cloudy insulin is important not only to ensure proper dosing but also to maintain appropriate concentration of insulin remaining in the container. Clear insulin should be drawn first, followed by cloudy insulin. Now, in correct needle, we know 100 unit needle is there, the 40 unit is there, and so mismatching of needles and syringes should never be done. Technique error, this is very important. For clear insulin solutions, resuspension is not needed. This is the way resuspension is done. Always check the insulin flow before you start. This helps you to ensure that you get your full insulin dose. Turn the dose selector to select 2 units. Make sure the dose counter shows 2. And tap the top of the pen gently a few times to let any air bubble rise to the top. Press and hold in the dose button until the dose count returns to 0. Now, this is the way resuspension is done. Dial. Turn the dose selector to select the number of units you need to inject. The dose can be corrected either up or down by turning the dose selector in either direction until the correct dose lines up to the pointer. And inject the dose by pressing the push button. By the way, it is the 0 line with the pointer. Now, insulin technique is critical in the therapeutic success of insulin. Improper use of needles may use to pain, bleeding, bruising, breaking and lodging under the skin, doses inaccuracy, poor glycemic control, and lipodystrophy. So what are the practical tips to minimize pain with the insulin technique? And we all will agree that ours is an insulin-phobic country. So we have to first assure the patient that today it is possible to give painless injections. Injection in use should be kept at room temperature. The moment you take out from the fridge, at least keep it for some time at the outside temperature. Skin should be dry before injecting if injection site cleaned with alcohol swabs. Injecting in the root hair should be avoided. Short needles with fine gauge should be preferred. And insulin should be inserted at 90 degrees to the skin. And the splitting of insulin dose should be considered if large doses are required. Insulin should be injected slowly, and care should be taken to completely depress the thumb button plunger while injecting it into the subcutaneous tissue. Painful injections can be minimized by all these things. So, bleeding and bruising associated with insulin injection is possible by use of insulin of shorter, as shown in the last slide, 4 millimeter to 6 millimeter length needles are available. And review of the injection technique, avoidance of bleeding, bruising sites completely. Lesser frequency of bleeding, bruising is reported with the use of needles of the shorter length. Right way to administer. These are the sites which we prefer: anterior abdomen, anterior thigh, buttocks and upper arm. And anterior abdomen is the most preferred site for the insulin administration, and the rate of absorption of insulin is maximum from that side. From the thigh it is minimal. Now, we all are aware about the importance of rotation of injection sites to avoid lipodystrophy. It can be done in the horizontal pattern, zigzag pattern, curve pattern, crisscross pattern, whichever the patient likes. And this picture, by dividing abdomen into 4 segments, and first considering the one segment for insulin injection for first 1 week, of course at the different sites, at making a distance of 1 centimeter at least. And then in the next week, the another quadrant can be selected, clockwise or anti-clockwise. Now, avoidance of reuse of needles and syringes are very important, because there is damage to the tip of the needle with use, and painful injection with bleeding and bruising is possible, and breaking off and lodging of the needles under the skin is sometimes it happens. So from the picture you can see a new needle, how sharp it is, and on the right of it, it is the needle has been used once, and third is the needle has been used twice, and last you can see it has been used 6 times. Right way to administer: average skin thickness 1.9 to 2.4 millimeter. Insulin needles between 4 to 6 millimeter needles can be used for subcutaneous skin administration without the need for making a lifted skin fold prior to injection. And the correct injection depth is like this, as shown with the subcutaneous layer. And avoid injection into the muscle is the primary thing which we should have kept in mind. And on the left you can see the improper method when the needle is going into the muscle. And the second, you can see how a wrong pinch has been made. In the pinch itself, the muscle has come. So despite lifting it up in a pinch, if you administer the insulin, it is going into the muscle. The right solution is on the right side. Why insulin should not be given intradermal route, you may ask. The poor technique results in intradermal injections, which are not recommended at all due to discomfort and potential for hyperpigmented patches and an increased risk of insulin allergy. Insulin pumps have come, and many persons are using that. The insulin pumps deliver continuous insulin, benefits are convenience, better glucose control, and site rotation is still kept in mind in insulin pumps also. The infusion site should be changed every 2 to 3 days to avoid irritation and tissue damage. Lack of rotation injection sites can result in lipodystrophy, and unclean injection site can cause injections. Properly, thoroughly cleaning operations should be there with water, soap, cotton or alcohol soaps, and it should be in the circular motion. If alcohol is used, the skin should be allowed to dry up completely before injection to avoid stinging sensation. And rubbing the injection site should not be done. And injection through clothing is also done sometimes by the patient, particularly when in the party and all. And that should be a complete no-no. Storage error: temperature, it should be stored at ideally at +2 to +8 degrees, never in the freezer compartment, it is in the side compartment. And during transportation, it is also very much important. The risk of freezing insulin product must be minimized and stored in an insulated bag, and it should not be kept in locked car with closed windows. And while traveling by air, insulin should not be placed in the checked-in baggage to avoid exposure to extreme temperatures. This is a very, very important point in this travel day. Never leave needle attached to the pen. Many patients, what they do, they keep attached to the pen. Why? Air bubbles form in the cartridge when cold, and insulin to leak out of cartridge when hot. And leaking free nest insulin can be arranged into a mixture ration. This can lead to incorrect mixture. It is important to prevent the entry of air and other contaminants into the cartridge. Now, leaving the needle with the pen, air bubble and leaking can also be there. So that has to be kept in mind. And the storage of insulin, with the protection against lights, direct sunlight and a strong artificial light is highly recommended. It should be protected from wet conditions such as rain and sleet and snow, and never send or keep insulin products together with dry ice. And the storage of insulin at home is also very much important in our countries, particularly in the village areas. It should be stored in a refrigerator, ideally between 2 to 8 degrees centigrade. And insulin vial cartridges should be kept at room temperature for at least 20 to 30 minutes, as I was talking about. Insulin should not be stored in this freezer compartment. And storing insulin in a small bowl of water where these facilities are not there, protected from exposure to direct sunlight and wetting of label during waterproof tape should be put on the batch. Using a small clip pot or earthenware pitcher to reduce exposure to external temperature variations with insulin vial cap is not submerged, and the labels of insulin named with of opening and date of expiry should be preserved. And using thermocol boxes for ice packs inside them as effective refrigeration technique for insulin that should be kept in temperature within acceptable limits. And keep a cool, wet cloth around insulin to preserve the potency. This is very challenging in cold weather either, where the temperature drops down to 0 degree and sometimes lower. The lack of central heating poses a significant challenge. And people in these areas are instructed to use warm clothes made of sheep and yak wool to protect insulin from the severe cold. One such piece of cloth is abdominal binder, which is 2 to 3 feet wide and 5 to 15 feet long. And health workers advise people to wrap the insulin to the binder, where the temperature recorded is between 5 to 10 degrees centigrade. And guidance on traveling with insulin, the most important thing is insulin in the hand luggage, never in the check luggage. Now these are the insulin carrier boxes. The to sum it all, as I said earlier, you may be a international scholar, but if you don't explain the technique properly to the patient, it is very easy to fail in controlling the glycemic temperature. And all these conferences and very important intellectual talks will go into the brain. So potential errors and subsequent correction. Patient's compliance with long-term adherence. Correct injection technique. And once the patient learns that it is painless, the compliance will definitely increase. And there are evidences to show that adoption of proper injection technique and regular assessment of injection site can lead to glycosylated hemoglobin reduction of about 0.6% in 3 months, which is equivalent to anti-hyperglycemic potency of many oral agents. A little more time spent by the physicians or nurses in a planned way is mandatory. The prescribing physician should indulge into a thorough discussion with the patients regarding the storage and administration, which we unfortunately are not doing. And sometimes we don't for the lack of time, and the patient is storing it improperly, taking it improperly. Providing the patient with injection grids or illustrative leaflets or proper injection technique may also help. And periodic patient education program by the healthcare providers, clinicians, and different patient groups organizations are of utmost importance to maintain proper techniques in insulin-sensitive patients. Thank you all for the present hearing.